What's going on, everyone? Welcome back to my channel. My name is Dr. Tom Walters and I'm an orthopedic physical therapist. In today's video, we'll be looking at exercises for a condition called thoracic outlet syndrome, which is an issue that affects the nerves as they come out of our neck, go under our shoulder region and down our arm. So if you have pain anywhere throughout that region, stay tuned for today's exercises. Before we get into the exercises, I just want to give you a little bit of information on thoracic outlet syndrome since a lot of people won't be familiar with this diagnosis. Basically, the nerves and blood vessels that exit our neck travel through a space right behind your collarbone that's called the thoracic outlet. So that space, again, is behind your collarbone and in front of your first rib. The first rib, if you trace your neck down, is right in this region. So those blood vessels and nerves are traveling through that space and then going down underneath your pectoral muscles and then feeding your arm. So if there's any kind of compromise here, it could be a job that involves repetitive tasks, sometimes people who are involved in whiplash, car accidents, and there are some people who are actually born with an extra rib called a cervical rib that comes out of their neck, and that can compromise the nerves and blood vessels. Today's video is going to really include exercises for thoracic outlet syndrome that affects the nerves. That type of thoracic outlet syndrome can get better with exercise. There is another type of thoracic outlet syndrome that affects the blood vessels, and if that's the case, exercise doesn't tend to help, and in many cases, people will need surgery to open up the thoracic outlet. So if you do these exercises and you're not getting better, make sure to go see your doctor to have imaging done. Sometimes it's an ultrasound, sometimes it's going to be a nerve conduction velocity study to find out what's happening there. Is it affecting your nerves or is it affecting your blood vessels? For our first exercise, we are going to mobilize the thoracic spine, which is the region of your spine right below your neck. Because thoracic outlet syndrome involves the nerves coming out of the neck, if we mobilize the thoracic spine and loosen that area of the spine up, it can help with issues related to the neck. So for this one, you're going to take a foam roller. You can use kind of a shorter one like this or a longer one. I'll put a link down in the description if you want to get one of these. What you're going to do is put it down on the ground. You're going to sit in front of it, hold the foam roller, and then kind of sit back so that it contacts the middle part of your spine. And then what I'm going to do is I can either cross my arms on my chest or hold my head. I'm going to pick my butt up and then just roll up and down that thoracic region, kind of going to the base of the neck and then work in the area between my shoulder blades. Sometimes your back will actually pop a little bit and it can kind of release tightness and feels pretty good. So just work through here slowly, maybe spend 30 to 60 seconds mobilizing the thoracic spine. If you find a really tight area, I've got one here, you can set your butt down and kind of arch your back over that area and kind of work your thoracic spine into extension, which is this arching direction. Okay, so just work through here for 30 seconds to 60 seconds to loosen up the thoracic spine. And again, that will help to increase mobility in the spine and take stress off of the structures coming out of the neck. Our next exercise is called an angel, and for this one, we're actually going to use the longer roller. So if you only have one roller, probably just get the longer one. This time you're going to put it on the ground in a way that's parallel, running lengthwise with your spine. So I'm going to sit on one end of the roller and then kind of slowly lie back so that my whole spine is supported from my head down to my tailbone. And then I'm going to do what are called angels. So I'm going to reach up and overhead. And what this does is it takes my shoulder complex through full range of motion, which is going to stretch my pectoral muscles and mobilize the nerves that go down my arm, those big peripheral nerves, which we have median nerve, ulnar nerve, and radial nerve. The nerves that leave our neck run underneath our pectoral muscles. So if we can loosen up the shoulder and those pectoral muscles, it will help take some of the pressure and stress off of the nerves and can help reduce thoracic outlet related pain. Okay, so go through this 10 to 15 times like this. This is an exercise you can perform multiple times throughout the day. You could do it 4 to 5 times, as much as it helps you. And again, one that helps improve shoulder mobility and nerve mobility and can help reduce pain. Before I get into the next exercise, just want to mention that you can find a program for thoracic outlet syndrome in the neck chapter in my book. My book has rehab programs for the 50 most common conditions, and each body region has its own chapter. So if we go into the head and neck section, you'll find this nerve pain program, which talks about disc herniations in the neck and stenosis, and then also talks about thoracic outlet syndrome. This program, like all the programs in the book, will take you through 3 phases and have pictures of me doing all the exercises. Essentially, it's like a program you get if you came to see me in physical therapy. So if you'd like to have a program that's more comprehensive, for the 50 most common conditions and allows you to do your own rehab at home. I will put a link for the book down in the description. The third exercise is going to be a stretch for some of our neck muscles, primarily focusing on the scalene muscles. So if I have symptoms going down my right arm, what I'm going to do here is bend my head to the left, sort of think about ear to shoulder, side bending to the left. And then from there, I'm going to rotate right, and I'm looking to feel a stretch right here along this right side of my neck. Those nerves are coming out in between our scalene muscles and then going down into the shoulder area and down the arm. So I can hold this for 15 to 30 seconds and then take a little break. If doing it that way is too easy, I'd probably just start this way, just like I'm sitting now. If this feels too easy, you can take your right arm and put it behind your back. That will help tack your shoulder blade down. It puts a little more tension on the nerves, so just be careful with it. Then again, I'm in a side bend. I can definitely feel more tension there, and then just gradually, slowly rotate right until I feel kind of tightness and stretch in the right side of my neck. So obviously if you've got it on the left side, exact opposite, bend to the right, and then look to the left and look for a stretch over here. Okay, so that's our third exercise, a scalene stretch. The last exercise will be a specific nerve mobilization for our median nerve. This is the largest nerve that comes out of the neck. It goes down to the thumb, index finger, middle finger, and part of the ring finger. If you have symptoms in the other fingers on the back of your hand, I have another nerve mobilization video. I'll put a link in the description for that one. It'll show you all the nerve mobilizations for the arms, but we'll start with the median nerve. It's the one that helps most people. So for this, you're going to put your arm out with your elbow extended, and you're going to extend your wrist. Now when you do that, you're going to move your head towards your arm. This tightens the nerves down at my wrist, but puts them on slack at my neck. And then I'm going to alternate, so now I'm going to move my head away, and then I'm going to bend my elbow and wrist. So now the nerves are tight at my neck and loose in my arm. And I'm going to go back and forth like that 10 to 15 times. This is sort of like the angel exercise. You can do this multiple times throughout the day as long as it helps you. So that one is our last exercise, the median nerve mobilization. So these are some of the best exercises for thoracic outlet syndrome. Give them a try. If you have any questions, put them down in the comments section and I'll get back to you. All right, you guys, see you in the next video. Bye.